Okay, here we go. I am about to get my second AutoCorre treatment under the eyes. Identify the notch so you don't inject into it. Notch will be right in there. You can feel it. Feel the notch?
That's here.
Yeah. Don't inject into there. Yeah, inject.
Into this bone, right?
Mm-hmm. You can go straight in. Give it a little wipe again since you touched it. If you wipe your finger with the alcohol, you can touch it. Making sure that you don't inject into the infraorbital notch by touching it with your finger, you can go down to the periosteum. Just use that 27 gauge needle and go straight down until you feel the bone. Gently tap the bone and pull back ever so slightly, and then start to inject very slowly. If you're on the bone, it's going to be much safer and you're unlikely to inject the vessel. So if you just inject very slowly right on the periosteum, you can safely inject into this area. Same thing on the other side. Just be careful of not injecting into the infraorbital notch, and go down to the periosteum, just gently tap on the bone, and then withdraw slightly and inject. We injected about 2 cc's into each side. Good. Now you can mix up the remainder of that gel and use that to inject other areas. And for this treatment, if it was a female, we could inject the lateral cheeks, and here we're going to inject my jawline, and she's going to again use that 27 gauge needle, and sometimes it does clot, so make sure it's flowing through the needle before you inject, and just go straight in, tap the bone, and then gently start to push. And we're putting 2 cc's right into that little depression in the jawline. Being careful not to inject into a vessel. Withdraw slightly to make sure you're not in the vessel. And if you stay on the periosteum, you should be very safe. But inject slowly. And now we're going to inject the other side. Same thing. Just gently tap the bone, and remember there is lidocaine in here, so it will help make the treatment very comfortable. The lidocaine, I find, does not affect the efficacy of this treatment, and it's much easier to do for you and for the patient if you use a little lidocaine to numb the pain. And here we're going a little further back in the jaw, and you're putting it again periosteally, and this is going to stimulate the fat above the bone, as well as I think it's going to stimulate some bone formation too, because this is a regenerative treatment. And we're injecting 2 cc's. If the needle clots, just switch it out, change to a new needle, and here we change to a 25 gauge needle because it's starting to clot a little bit, so you have to work a little fast so that the PRP doesn't clot up. And we're just gently injecting, and here we hit all the spots that we wanted to today. And with the numbing, it's going to be very comfortable. It's going to stay numb for like an hour or so, and then it's going to get sore. Just warn the patient that they will have some soreness and to expect that. So just inject slowly. Put 2 cc's in there, and then just make sure it's not bleeding. And then you can see it's very subtle, but you can see the skin changes almost immediately. You can see the changes in the skin. There's a glow to the skin, and you can see that I'm really loving this treatment. Thanks for watching. This is Dr. Song.